What we're going to do first of all is a couple of things you guys want to go over are upper limb tension tests. We'll go through like lots of the handling techniques, we'll play around with the upper limb tension test. Has everyone done the upper limb tension test before? We can all just practice on each other, and if something feels a bit odd and a bit weird, fine, we work out what's going on, okay? What we are going to look at first of all is the radial nerve. Big thing with this, guys, is that we need to kind of get that depression of the shoulder, okay? I'll use this part of my hand to create that kind of downward force. And then here we're going to use the hand, and we'll put that into this sort of motion here, into a little bit of flexion through the wrist. I'm going to create a downward force. I'm going to come down and pull through here. Next position, I'm going to take our arm at sort of shoulder height. Again, using my hand here. This arm is going to be supported onto my leg. And I'm going to go into a lovely bit of extension with that wrist. Left ear to left shoulder for me, sorry, Em. And then come out, lovely. Okay, then we go into the next one, which is the ulnar one. So bend that elbow for me. So a lot of people do it differently here. They can interlock like that. Well, I prefer this position here to go into a bit of that wrist extension and finger extension there. So create a downward motion, go into that little bit of extension there. You okay? Again, do you see what I'm pushing up with here? My leg, okay? So I'm pushing up through my leg there. Today we'll start with the radial nerve, okay, and have a little look. Like an ulnar nerve glide.
The one that I normally use is that same position and then moving in and out of this.
The easiest way to remember this is like trying to make some glasses, and you can then get the double glasses, so you look really cool. And what about the medium then? What do we guys like to do with this one? Teapot, okay, who's going to show me the best teapot? Good, hands on the wall there, good, and then you can keep the tension on or you can release. This is keeping the tension on. If you want to release, you can then just take your hand off. This one, the better you'll get is just from practice, okay? It's just practice, practice, practice. What we'll do is we'll go into the neck extension first of all, okay? I will just show you how we do the neck extension first of all, and then we can play around, okay? We're gonna start quite nice and high up, okay? What we're gonna do, the motion is pretty much, is you're gonna try to almost hook under, okay? As you're hooking under, you are then gonna move with the patient and just guide them back. So you can say, okay, gently come into a bit of neck extension, and then come back up. Another little point, so I'm going to hook under, create a little bit of tension as you go through here, keep that tension on, twist, 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 well done, good, and then come back out.
I feel like
Perfect, guys, okay, good work. Next session, we'll go through some other little bits and bobs as well. All right, good, go enjoy your days.